Good morning. I'm Dr. Tonya Thornton, Neaves, and welcome to the course sampler for PUAD 630, Emergency Planning and Preparedness. I'm glad that you're able to join, and this is my first time doing a video session via Zoom, recorded without other participants, but hopefully we'll make it through just fine. I'm going to begin sharing my screen. Let's see. There we go. Today, I'd like to give you just a quick overview of what the course is about. And to begin with that, it's really important to understand the social construction of disasters as it relates to emergency management in the United States. But first, let me tell you a little bit about who I am. I was born in the Mississippi Delta, so lots of catfish. I have a variety of background, a little bit of Irish, a little bit of French, a little bit of Greek, Croat, Italian. Yes, I can hang 6 spoons from my face. I got all of my degrees from one university, Mississippi State University. I had my bachelor's in political science and geosciences, started working in R&D, and then lo and behold, before I knew it, I was working full-time and getting my master's or earning my master's and my PhD over the course of the next 10 years. Upon graduation, I took my first academic posting at George Mason University, and here we are. I consider myself a pracademic because I grew up in R&D, so I didn't have that linear background in just the academy. So it's like scholarship connected with communities of practice. And yes, I included the biggest claim to fame, things that make you go hum. I guess that would be I appeared in the Sports Illustrated magazine with Dak Prescott when he took Mississippi State's football team to the #1 position back in 2015. Had no idea it was occurring. So I already covered all of this. So what about me now? Well, I am the Director of Extramural Projects at George Mason's Schar School. I also am an Assistant Professor of Research. I run Centers on the Public Service, and I also direct the Virginia Certified Public Manager Program. So I wear many hats. I'm involved with the Center for Resilient and Sustainable Communities, and I'm also an advisory council member for the Institute for Sustainable Earth. So, why am I interested in such terrible things? A life of hope and despair? Well, since I grew up in Mississippi, I experienced one of the first active shooters at Pearl High School in 1997. It was about a year and a half prior to Columbine. I also got to experience Hurricane Katrina, lots of tornadoes, and my dissertation was on the oil spill. So we know today that not just the national, but the international community faces a series of disasters that cause thousands of deaths and cost billions of dollars. And then recovery, aid, disruption of critical infrastructure, destruction of homes, and then obviously there's the economic impacts that are often associated with disasters. So we know that the risk is continuing to increase. We're living in the world of COVID-19 right now, along with a projected very active hurricane season. We know that population growth will also result in an increase to places prone to more disasters. And then there's this nexus between safety and sociocultural respect, given what we're facing right now with regard to racism and racial reconciliation in the United States. And it is an essential role of government to manage these events, but not only manage, but mitigate. Disasters don't occur unless there is an interaction with humans. Otherwise, it's just in the natural world, it's just a natural phenomenon, whether it's a tornado. So when a tornado intersects with a city or a home or other types of infrastructure, that's when you have damage. And not just damage of property, but also injury, loss of life. The consequences of disasters are often broad-based, long-term, and unanticipated, because we also see that social capital and political trust is uniquely connected to how we manage these focusing events. Place is an important part of our identity, and we know that society is characterized by these shared experiences. There's this old adage that, south is a place, north is a direction. Well, the same could be said for other idioms across the country, as well as across our international community. We know that tradition is not our only source of values, and that social and political action takes place within these shared histories. So that's why you see such variations in disaster response and recovery, from Hurricane Katrina to Superstorm Sandy, or if there's an oil spill in, Exxon Valdez in Alaska in 1989, or then you had the Deepwater Horizon oil spill that occurred in 2010. So we know that place impacts these response efforts. And we know that ideologies differ among a range of issues. Do you believe the government should take care of you and your family following a disaster? Or do you think it's your own personal responsibility? But we have to understand these issues, characterize them before we can actually define the problem. So let's go over some quick terminology. A lot of people use different synonyms to classify or even quantify disaster experience. We know that emergency could be a traffic accident with an emergency transport. We also know that it could be a crisis, a riot violence, protesting. It could also be a disaster. That differs from a crisis, which is an abrupt event that occurs within a very specific time frame. It's not like COVID-19 where there's this pandemic that's been going on for months now. A calamity is an event of great misfortune, leading to great loss and lasting distress and suffering. And then beyond that, if you're looking at the scalability of disasters, a catastrophe is the violent and destructive event ranging from extreme misfortune to utter overthrow or ruin. And so when thinking about different disasters that may have impacted you or some of your family members and friends and colleagues to those around the world, we can often kind of classify, but still, it's hard to actually quantify. So because of that, I want to run a quick Google Analytics viewer. And if you have never played with Google Ngram, it is a project between, or partnership rather, between the Harvard Cultural Laboratory and Google Books, where they digitize these literary texts. And as you can see, an Ngram is a word, a single word, up until 5 words. So you can have phrases, and you can run them against each other. So you can see back to 1800, since given all the books that they've been able to digitally scan, literary text again, you can see that it wasn't until about 1920 that we started seeing the uptick in the terminology around disasters. Again, emergency can mean very different things in different cultures at different times. Same thing goes to crisis. It can be an oil crisis, it can be a political crisis, it can be a racial crisis, it can be just about anything. Calamity is reserved, as is catastrophe, for the most extreme cases. But again, you can see that if I were to take away crisis and emergency, and we just ran the 3 main terms, boom, there you go. And again, if I scroll down, you'll be able to see that it was around 1900, 1920, when we started seeing this uptick, and it became part of our everyday lexicon in American English. So what happened in 1920 to make this transition, or around that decade? Well, we had several things going on. We had the Great Depression, we had the Dust Bowl, we had the Great Mississippi River Flood. So, and we also were coming off the heels of World War I and almost heading into World War II. I mean, another decade later, but still. So I encourage you to play around with this very fascinating and very useful tool that gives you a background in terms of the contextual background of things that are occurring. So, disaster. What do we mean by a disaster? Deadly, destructive, and disruptive event that occurs when a hazard interacts with human vulnerability. Again, that's that social construction piece. Now, back in the 1800s, we didn't really have a good grasp on disaster because our global population was still very small. So people often use the word hazard to describe an event, but we know hazard's not the actual event. It's the source of danger that poses a threat to life, health, property, or the environment, okay? So being able to navigate the lexicon waters, if you will, is very important in how we qualify and understand history, the history of our disasters. So let's talk about what the hazards are. Well, there's natural hazards, which are rooted in the natural environment. They're often considered acts of God, and you can also find this in a lot of insurance policies, act of God. Whether that you believe in that or not, that's not the point. The point is that it's perceived with a lack of control, and that is not preventable because you are not in control, someone else, God is. Man-made is very different because it's often caused by humans. Well, it is caused by humans. It's the result of human intent, negligence, error, or system failure. Sometimes it's just accidental. It's thought to be not predicted, but preventable. There's often an identifiable party to be held responsible, and it's associated with a perceived loss of control. So one is a lack of control, one is a loss of control. So detecting hazards. Well, oftentimes we think about the 6 serving men, the who, the what, when, where, why, and how. Okay, if you can answer those questions, a lot of times you already are providing that contextual background to that specific disaster that has occurred, right? Or you are able to not have a lack of an imagination to have an idea of what hazards may occur. And each requires different methods of detection. A lot of times it's just field work, sometimes it's senses. I'm sure many of you have seen the movie, oh, what is it? Came out in the 90s, Twister, that's it. And he could just go outside and he could feel, and he just knew where the tornado was going to occur. Is that real? Well, I'm not a broadcast meteorologist. I'm not a meteorologist. I do have training in geosciences, so I can kind of relate to it, but at the same time, I rely on data. That's what science does, right? And you can also kind of pick up on the news, or if there's traffic on the radios between, first responders, or if, depending on if there's a surgeons at a hospital. But still, disasters are so much more complex than that. And oftentimes they're not mutually exclusive. You can have them occurring together. You can have one leading to another. You can have a natural leading to another natural leading to a man-made. You saw this in the case of Hurricane Katrina. You had a significant damaging hurricane that caused levees to break because of the waters and the canals in New Orleans. Then you also had spinoff of several tornadoes, because typically they occur at the north corridor of where the hurricane is occurring, or in its outer walls. And then also human vulnerability. We tend to complicate things all the time, right? So we can exacerbate these impacts. And then at the end of the day, serious challenges must be met and dealt with in a moment's notice. And we're not very good at prioritizing this, because most of our emergency management planning has been rooted in civil defense from the 1980s during our Cold War era. I'll come back to that more momentarily. But let's talk about some vulnerability, some things that maybe we know, but things we may not know. Geographic location, again, place matters. And place doesn't always have to mean a jurisdictional boundary. Maybe it's a sense of how you feel, of culture. Demographic factors, we're seeing that a lot right now with COVID-19, especially rural communities that may have a lack of access to healthcare or even quality healthcare. We are also seeing racial differences and how we're being treated in hospitals, as well as how it's impacting our physical bodies. We've already said that growing population is just the defining factor of where you're going to see a lot of damaging impact on, critical infrastructure, population, economic resources, persistent poverty. Again, Hurricane Katrina in the Ninth Ward. You also saw some of this with Superstorm Sandy and some of the more vulnerable communities, such as nursing homes. And you see this too with COVID-19. Drawn urbanization, because there's a lack of zoning or proper zoning, or maybe there's not the proper codes. You saw this in Houston recently with a lot of flooding downtown. Enhanced globalization, more industrialization, improper land use and inadequate construction, and yes, an expanding sense of entitlement. And the reason why I mention this is because oftentimes we do expect the government to come in and take care of victims and their families following a major disaster. But is that realistic? Is that feasible? Can we afford that? I don't know. I don't know all the answers to these things, nor do policymakers, but I can tell you that these are the things that we explore, so then that way it gives you the tools, the knowledge necessary to make those decisions moving in the future, because every place is different, and every locality, state, and obviously the federal government is going to respond very differently. We also have even more vulnerability, weak emergency management. The field is still relatively young. As I noted about the Cold War, and we were rooted in civil defense, we didn't actually kind of coalesce as an academic field or practice of study until about the mid-1980s. Then we didn't really have more of a natural or man-made focus until President Bill Clinton made it a cabinet level position with FEMA. And that was during the mid-1990s. Obviously 9/11 occurred, and then the Department of Homeland Security was established, and FEMA went underneath that unit, or that agency, rather, department. Again, humans are dependent upon the climate they live in. Changes in global average temperature have always occurred, and the impacts to the natural environment has a vicious cycle. So you're seeing it this week, in fact. And if you don't know the date of this screening, today is June 23rd, 2020. And we are seeing the Saharan desert sands kind of impact the Caribbean, as well as portions of the Southeast mid-Atlantic states in the United States. And then also there are other factors. There's the Milankovitch cycle, and that's essentially you have orbital fluctuations, you have tilt fluctuations, and then you also have, are wobbling around the center of the Earth. We have atmospheric variations, and then obviously plate tectonics also plays a role in where disasters, especially natural phenomenon, occur. So, brief history, I touched on this a minute ago, but piecemeal approach in terms of disaster planning and response. But we have existed, the idea has existed since the early 1800s when rampant fires spread across New Hampshire. And the 7th Congress at the time passed a number of relief measures in order to help build back the tax base to rebuild the town. 1930s, I also mentioned with the onset of the Great Depression, the Reconstruction Finance Corporation was created to stimulate economic activity. In 1978, disaster relief was created by the FDAA, which was an independent agency. And then as I noted, that was later with President Clinton, but cabinet level position, executive order by President Carter established the FMA. Note that that's not FEMA, that's FMA. Independent agency, as I noted, reversal of attention back on civil defense with the establishment of DHS in 2002, when it merged 22 agencies. So what is emergency management? Well, simply it's the discipline of avoiding risk to hazards, as well as dealing with both natural and man-made disasters to lessen their impact. They're going to occur. It's an academic field, as well as a community of practice. And emergency managers really do have the KSAs to build capacities to help reduce the risk associated with these hazards, as well as develop measures for disaster resiliency. And I know there's a lot of discussion going on right now around what does resiliency or sustainability mean, and everyone wants to have it fit within their own thematic or topical area. But for me, resiliency doesn't have to be pigeonholed into one area or one definition. I look at it as a methodology, an approach. You want to build capacities no matter what the challenge is in order to be sustainable in the future. That may mean measures for local government. It may mean measures for your own personal home. It may mean measures for public health. So everyone can agree that it's an approach, and then it can apply however you like it to your own personal situation or your own area of expertise. And then first responders are an extension of emergency managers to assist with activating measures to reduce damage associated with disasters. And these are often your law enforcement officers, your fire and EMS, other people that work in the medical community. So first responders are those that are on the front line of when disaster strikes. So there's 4 generally agreed upon phases of emergency management. First is mitigation. Those are those things that you can do in place like zoning and other construction to mitigate any type of hazard. Then you have to get into the preparedness, the second phase. And that's putting plans together, whether that's communication, mutual aid, noting whose role in emergency function, who's playing which role for the emergency functions. Then obviously you have the third, response. When the disaster actually strikes, you've got to get in. And disaster response typically is the first 72 hours because that's when lives are at stake most. And then we've seen with the 4th phase, recovery, that it can be a very immediate or it can take decades to really rebuild some of those things that have lost, or sometimes the communities and the culture that was once there. Just a quick overview of what I just explained. So mitigation, preparedness, response, and recovery. Yes, as noted earlier, there is a significant impact upon critical infrastructure by disasters. And we know that critical infrastructure supports the lifeline systems that are essential to the successful functioning of governance and society. Typically, these center around 4 major ones. Now, there's more than 4 for sure, but typically there are 4. Communications, transportation, water, and energy. Energy kind of powers all 3 of the other systems. Now, many of you may think, oh, well, there's water and there's aquifers and then there's rainwater and other types of sources. Yes, that's true. But a lot of the other systems are powered. Say hotels can't, if you have zero gravity, you can't pump the water to someone's room unless you have electricity. So just keep that in mind, that they're all connected, but they really have to be powered by energy. And the capacity and the equity of these systems are pressing problems for all sectors. And the conversations around we need to reinvest in critical infrastructure, yes, we do. The question becomes is what is our priority and how much money do we want to spend in any given sector? But there are many other sectors. That's where this nexus between the critical systems comes from, because we have to do a better job at continuity planning for our critical infrastructure. And we know that there's a financial and political risk to these systems. So DoD looks at critical infrastructure very differently from DHS. DHS looks at it very differently than the Department of Education. Department of Education looks at it very differently than, say, the Department of the Interior. And as we all have seen, we're not very good at information sharing or coming together and truly collaborating at the federal level, because everything is either classified or it's sensitive or it's on an as-need-to-know basis. So that was our great failure in 9/11. And that's when the 9/11 Commission report also mentioned that we don't need to have this lack of an imagination. But I would say, let's take that a step further. Let's not have a lack of information sharing, okay? So global challenges, disasters no longer occur within a limited geography. I put it up there as that it does, but we now know with the current COVID-19, and that's what I wanted to highlight, it is no longer limited geography. It can impact the entire world. This is the first time in the United States history that every state has declared a national emergency or a state of emergency. We know that traditional crisis models have typically focused on post-crisis response, and we're still very much this way. And so making emergency management programs and courses and certificates and degrees is very, very useful, because again, we're still a new field. And so we're learning a lot and we need to share it faster. We also know that policymakers are often ill-equipped to handle many of the social, environmental, and economic elements. And I don't mean this as a knock to our policymakers. It's just you cannot be a subject matter expert in every single thing, nor can your staff, okay? Also, if communal networks are to be disrupted, there will be a lasting impact on the community. Again, Hurricane Katrina, New Orleans is still not the same, and I know it's Nolans. So, you know, it's important to know place and then also how they pronunciate what their own place is. There are many local solutions, and this is what we're beginning to see, are local solutions, regional compacts, and other areas coming together to respond more effectively to different types of disasters. Again, understanding disaster meaning is essential to the problem-solving process, going back to the original point of social construction. We need to increase our communication so that we can enhance cooperation, and not just cooperation, but coordination, because that will be seen as a relevant means to ideological bridge building. Because at the end of the day, education, clean water, response to disasters, and planning for, these are not political issues. These are societal issues at large in which we all need to come together in order to bounce forward, okay? Decision-making models have highlighted a need for collaborative partnerships. So this model that I will get to momentarily. It's the 3 C's. And that's what I mentioned at the last point, is this framework for operations should be developed in an integrated manner. Again, disaster planning and response is not a political issue. So where is the true breakdown? Well, I am suggesting, and I've been working with DoD and other partners, and to a degree VDM, the Virginia Department of Emergency Management, and other agencies and organizations around an integrated approach to community resiliency and sustainability. I noted earlier that this is more of an approach rather than, a definition for a specific or a thematic topical area. So in this Venn diagram, you see emergency management, public safety, and homeland security. We need to come together in order to be able to information share and not having a lack of an imagination, and be able to speak the same language and be on the same team. Oftentimes, fire and police are at odds. Sometimes public safety and homeland security are at odds. Sometimes emergency management and public safety are at odds. Now, you're probably wondering, in the world of COVID-19, where's public health? Well, public safety can mean a lot of different things, as can emergency management. I did not want to make you feel that I didn't want to note that, okay? So that is a very big component to public safety in my mind. But public health is not my background, so I don't feel qualified to speak to it as much, right? So utilization of the 3 C's, we have to increase our communication. And this is kind of what we're doing right now, is by me offering a course sampler as to what you might learn about or dive into further if you were to take this course, or PUAD 631, which is disaster response and recovery operations, or some of our other special topics that are often taught by myself or other leaders in the field, practitioners. academics, right? Those that actually are in the world of practice, but then we steal them away every once in a while and put them in front of you all. So then that way you get a first-hand experience in the classroom of someone who's doing it day in and day out. Then we have to enhance our coordination, right? And it's not just coordination, it's cooperation, because if you increase your communication and enhance your coordination, obviously you're going to be more cooperative. But we cannot just stop there. That is just 2 of the 3 C's. We need this meaningful collaboration to occur. And there's many ways to do this, but it has not taken hold quite yet because of that lack of information sharing. Maybe it's a use of jargon. Maybe it's a not understanding what emergency management from a community perspective really is. So me having been trained as in the academy with practitioner experience in the R&D world is very different than military or paramilitary background. So you even see odds at that right now in terms of how do we communicate with one another? How can we make it work? Okay. So future prescriptions. It has become important for decision makers to ask questions of why, where, and why there. We also know that policymakers have attempted to reduce the impacts associated with disasters by anticipating the unexpected, but still we are very reactive, not proactive. Given the limited opportunities for crisis-related experience, decision-making, mental models, and situational awareness research on crises have highlighted a further need for effective emergency management. We're still a young field. We are still working very hard at understanding what those models are. They apply differently in different disasters. They apply differently in different places, and obviously in different countries, because there's legislative code that we have to pay attention to. There is a societal conditions. There are cultural competency issues. So when we talk about things really do occur at the local level, they really need to, because that's where the prescription is going to come from first. Local authorities are becoming the force multipliers for state and federal officials in addressing new hazards and threats, because they know their community and they're the ones who have repertoire with the community members. And so they're the ones who are going to be able to get the community on board in terms of moving forward or developing new behavioral practices. Some final food for thought. Rethink what policy means in light of polarization. Remember, disasters are not political, but we live in a very political world and country. We need to have a tri-sector vision for a changing marketplace. Government works very closely with business. Business works very closely with government. The same is also true for our nonprofit world as well. We need to navigate the financial burdens of traditional operations and position scientific research relevance in a rapidly changing world. We need more connection of scholarship with communities of practice, because it adds this real world value. And we need to also question whether politics now trumps policy and expertise. And I don't want you to think that that's a political commentary, but really that's what people are asking is, politics trumps policy and expertise, because at one point we relied on scientific expertise as a driver for how we were making policy. Today, everything seems to be extremely polarized. So that is the end of this quick course sampler. Oh, I lied to you, it is not. This is just a recap of what I've already said. There's always going to be challenges. There's always going to be some type of decision remedies. We are crisis reactive. We love our hazard attraction zones. We have a fragmented systems perspective. We need more situational awareness. Look around. Do you sit with your back to a door when you go to a restaurant? You know, in the world of active shooters, that may not be advisable. We also need to do a better job of returning to a period of normalcy as quick as possible. The Israeli response model does this very well in terms of they have a team go in after some of the, shell casings or other types of damage to their infrastructure to quickly patch and repair. So then that way, even if you're hearing bombs go off or shotguns or firing going off in the background, at least the buildings look the same. I encourage you to investigate that further. And then again, the 3 C's model. We need to design more preferable models that are useful to our localities. So, okay, I'm gonna leave you with this final thought. There's the quote by Karl Marx is very relevant to emergency management and public administration. Administration is determined action taken in pursuit of a conscious purpose. It is the systematic ordering of affairs and the calculated use of resources aimed at making those happen which one wants to happen. Notice that determined action, conscious purpose, systematic ordering, and calculated use. That's what we want in our life of public policy, public administration, even our own personal world, right? We know we don't have an infinite amount of resources. We know that there has to be some type of ordering to preferences and how we move forward in different types of crises or hazards or just in everyday life. We know that we need to think about these things before we start making these actions. So this quote really sums up a lot of what we're trying to do in emergency management. So I thought I would share. So that is the end of this course sampler. I hope that you enjoyed it. And if you have questions, obviously you can get in touch with the Schar School of Policy and Government's admissions team, but you can also reach out to myself. And there's my email, tneaves@gmu.edu. And just to note, I am the coordinator for the Emergency Management and Homeland Security Graduate Certificate or concentration at George Mason. So hope you have a wonderful day.